Good evening, everyone. We'll be having a continuation of our discussion. So number 26 is all about transmission of the infection of the microorganism. So we're talking about the infection prevention here. So what are the things that we need to remember when you say infection prevention? So first things first, we need to make sure that you know the concept about infection control. Okay? When I say infection control, this is the way we manage if there is microorganism that is attacking to our patient. So we protect ourselves or we protect the patient. So we gonna have this concept about how to perform, how transmission of infection happens. Okay, so we do have your chain of infection. So we start with the chain of infection, meaning to say, meron tayong tinatawag na kadena ng mga infection. So this is all about there's no ending on it. So it started with microorganism and it goes with what you call your reservoir, ang bahay nila. Pagkatapos niyan, meron silang tinatawag na kailangan nilang lumabas, which is portal of exit. So mauna talaga ang exit over the entry. And then, pagkatapos ng exit, meron silang mode of transmission. Okay, may dadaanan muna sila. Example, mga saliva, dugo, whatever it is. Then, portal of entry, papasok na sila doon. And then, saan kanina sila papasok? Siyempre sa host. Then tayong mga host, pwede tayong magtae, magsuka, maglaway, or mag-ihi, doon lumalabas ang microorganism. So, babalik na naman siya ganito. So, it is called your mode, chain of infection. So, remember that in your chain of infection, we have what you called the mode of transmission. So, mostly of the mode of transmission na lumalabas sa exam is your airborne and droplet. So anong kaibahan ni airborne at ni droplet? When you say airborne, tandaan si airborne, ito po yung mga tinatawag nating less than 1 meter, no, more than 1 meter and more than 3 feet. So meaning to say, wide ang coverage niya. Kahit, for example, nag-lecture ako doon sa platform and then kayo nasa upuan, pwede kayong ma-atake ng airborne. And like in the airborne class, ginagamit talaga niyan is N95 na mask. Hindi po pwede na surgical mask lang, whatever it is the mask, ordinary mask lang. Common na mga problem nito ay may mga TB. Okay? Sila yung may mga airborne na problem. While ang iba naman niya ay si droplet. When I say droplet, ito na po yung less than 1 meter and then less than 3 feet. So short lang coverage niya. So best example for this one is your COVID-19. Kaya na-notice mo, 1 meter lang ang distance natin, yung social distancing. So that is your droplet infection. And when I say droplet infection, when I say mode of transmission, take note of this, that we have what you called, oh, hold on. We have what you call the device to protect ourselves, like your PPE, no? Ano ang pinaka-common na device na ginagamit natin to prevent the transmission of the microorganism? Very good, the word gloves. Pero ang gloves class, binabagayan yan siya kung ano yung procedure. For example, it is a surgical procedure. Siyempre, ano ang dapat na gagamitin natin dyan? All right, very good, sterile. So the first spell that I'm going to give you is this one, the spell that you need to remember, the principle, shall I say, sterile to sterile, and the next one is clean to clean. Okay, just make sure that you memorize the spells so that magic can occur. So surgical for sterile. Now, if I'm going to perform, I'm going to assist the doctor for an operation. Of course, I'm going to use what? A sterile gloves. If I'm going to perform what? I'm going to assist an operation, you need to wear sterile gloves. How about when I do an IV insertion? Of course, you have to use sterile gloves. How about catheterization nursing? Of course, that is surgical technique, sterile gloves pa rin siya. So catheterization, ginagamitan natin yan siya ng sterile gloves. The other one, the gloves, is what you call the open gloves. Open gloving tuloy, sorry. Clean gloves, okay? The clean gloves. Pag sinabing clean gloves class, hindi siya pang surgical technique o hindi siya kailangan ng more na precaution dito. Kasi nga, the area is already as a microorganism, so we need to decrease the microorganism. So using a clean gloves is only for medical asepsis. Pag sinabi kong medical asepsis, ito yung decrease microorganism. While ang surgical asepsis, eliminate microorganism. Okay? Eliminate microorganism. So pag sinabing eliminate microorganism, so tandaan that this is all about your surgical asepsis, sterilization technique. Okay, ano mo procedure ginagamitan ng clean gloves nursing? For example, oral suctioning. So, oral lang suctioning, pero ang nasopharyngeal and your endotracheal, it is your sterile gloves. So, oral suctioning and procedures on your rectal area, digital rectal examination. So, kailangan niya siya ng clean gloves lang. What if, Nurse Jane, I have an allergy to the gloves, no? Latex allergy. Latex is made up, your gloves is made up of latex. So what if, Nurse Jane, I do have a latex allergy? What am I going to use? All right. So what I'm going to use is use your synthetic gloves. No? But synthetic gloves will not assure you to maintain the sterility of the area. So anong gagawin mo? Maglagay ka muna ng a pair of synthetic gloves to both hands. Then, pagkatapos mong malagyan ng pair ng synthetic gloves, ilagay mo yung sterile gloves or yung latex sterile gloves mo. So, yun siya if there is an allergy to latex. And it is common hide in what food? Banana. Okay, banana yan. Now, next would be, if you are talking about medical asepsis, remember, when you say medical asepsis, what I've told you, ano nga ginagawa? Eliminate or decrease? Decrease microorganism. So, for example, there is an order of medication or redressing on the wound. Okay, redressing. So, redressing means na dress niyan siya, it's about to heal na ang wound, and redressing with medication. So, what would be the best answer for this one? Of course, you need to remove the gloves first. Remove the gloves and then what? Do hand washing. Okay, do hand washing. Then apply the meds. Apply the meds. So redressing with meds. Okay, remove the gloves and do hand washing and apply the meds. Okay, hand washing is what? Medical or sterile technique? Okay, this is your surgical asepsis, no, medical asepsis, which means it only decrease what? Microorganism. And remember, 20 seconds lang ang ating hand washing ha. Okay. Now, on hand washing, be careful on this one. Okay, alert, alert, alert. When you rinse your hands, when you rinse your hand, make sure it should be always below your elbow. Pag medical asepsis. While scrubbing, take note, always above the elbow ang hands. To maintain what? Sterility to the area. Okay? So, after that, let's have number 26. So, the nurse knows that the most likely means of transmitting the disorder is through what? Okay, very good. This is through the contact of healthcare workers' hand. Especially, you're transferring from one patient, you're taking care of patient from the other room to another room, another case to another case. That would be a transmission of microorganism. Letter D, dog. 27. When a nurse is performing surgical, when you say surgical, ano yun siya? Eliminate all microorganisms, especially when you are going to perform an operation. So, anong answer? Above the elbows. Letter B. 28. Number 28, this is all about the nurse wears a mask while checking the patient's temperature. Why? Kasi ang tinatanong is the strict isolation. There are two types of isolation, strict and reverse isolation. Pag sinabi kong strict isolation, this is a type of isolation in which the nurse wears the mask. On the other hand, the patient wears the mask. So, bakit Nurse Jane? Because sa strict isolation, si patient ang infected. No? Siya ang infected. Therefore, we need to protect ourselves, so we will need to wear mask. So, example, when we do have a COVID case, strict isolation talaga ang ginagamit natin. While this reverse isolation, take note of this one, most of these patients are immunosuppressed. When I say immunosuppressed, these patients are what? Okay, prone to microorganism. So, they are prone to have an infection or immunocompromised sila, dapat sila ang mag-wear ng mask. Okay? And make sure this should be away from the station because this patient are really what? gives a higher precaution for the fact that they are prone to infection. So letter C, the nurse wears a mask while checking the patient's temperature. 29. So the now plans administer a medication to the patient. The correct infection control procedure is redressing. So redressing is all about removing the gloves and perform hand hygiene before administering the medication. Letter C. 30. Latex allergy, okay. Anong sinabi ni Nurse Jane? You put pair of synthetic gloves and then before donning the latex sterile gloves. So that's it. Now, the number 31 is all about hygiene, so bed bath. When we say bed bath, guys, a bed bath is all about a procedure by the nurse, independent function, in which hindi na kailangan ng order ni doctor. This is to promote comfort to the patient. Always remember why we are with our patient, because we need to provide what? Comfort to them. So in bed bathing, always take note that we start with the head. So head first, and on your head, on your face, okay, slash face, it should be an S motion, okay? S motion siya. And if ang eyes ang tinatanong, always remember from inner to outer canthus ka magsisimula. And then pag sinabing sa chest and back, make sure that you start with, by doing it through circular motion, okay? Circular motion. Unlike with the extremities, lower and upper, we need to do it from distal to proximal. Okay, the reason behind is that we always remember, all right, take note of this. Another spell to remember. A spell to remember, ding, 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 ding. This is all about. When you clean the patient, always do the clean to dirty area. No? Especially when we have this operation in OR, we need to schedule the operation based on the dirtiest and the cleanest of the operation. So pag dirty ka, you last operation ka talaga ginagawa. So spell, clean to dirty. Take note of that. Another one is that when you do the extremities, make sure it is a long, firm stroke. Bakit long, firm stroke? Dahil it promotes what? Increase venous return. Alright? Now, question is 31. Sino ang unahin mong i-bath? The answer is a patient who experiencing frequent incontinent diarrheal stools. Why? This stool class has this what you call chemicals that would dry the area of the patient's skin. So once the patient is having this kind of situation, pwedeng magkaroon ng skin breakdown, so madamage ang skin integrity ni patient. So letter C is the correct answer. The nurse is assisting the patient with lupus and bath at the sink. During the bath, the patient states that she is tired while breathing rapidly. The first action of the nurse is leave the patient alone to rest in the chair and the sink for a few minutes. Remember that they have this what you call photosensitivity. When you say photosensitivity, their skin is sensitive to temperature. No? Their skin is sensitive to temperature, the SLE. Take note of that. Anong kaibahan ni photosensitivity and ni photophobia? Pag ako nasilawan, silaw, that is photophobia. Pag photosensitivity, am I referring to the skin? For example, I got sunburn, so my skin is very sensitive on it. So this is common to a patient with SLE. Okay? And when you say SLE, this is an autoimmune. Pag autoimmune siya, type 3 yan siya na hypersensitivity. And the answer is letter C. During the bathing, your patient experiences shortness of breath, labor breathing. So, pag ganyan, all you need to do is make sure naka 60-degree Fowler's position. Okay, the positioning goes with high Fowler's, semi-Fowler's, and low Fowler's. Mostly of the high Fowler's na ginagawa dito pag nagkakaroon ka ng mga prenatal check-up, what else? The patient should be put in a wheelchair or the patient is sitting. So that is high Fowler's because it gives 90 degrees angle. While Fowler's is 60 degrees angle and semi-Fowler's is 30 degrees angle and low Fowler's is 15. So sa Fowler's class, once you have your difficulty of breathing, then you go with the Fowler's. Ito pag increase ang ICP, yan ang gagawin mo. Semi-Fowler's basta increase ang ICP. Ito siya pag mayroon kang dumping syndrome. No? Pag dumping syndrome ang problema, then go with your low Fowler's. So the answer is letter C, cat. Huwag mo siyang in Trendelenburg. Okay. Trendelenburg, usually ginagamit siya saan? Okay, very good. Sa shock patient. Sa shock patient, para magbalik ang dugo mabilis sa kay patient para mag-increase naman ang volume. While the reverse Trendelenburg, pag lumabas na naman sa exam, ang reverse Trendelenburg, ang isasagot mo lang dyan is for what? Gastric emptying. No? Gastric emptying lang ang ating reverse Trendelenburg. Well, the semi-followers is what I've told you, that is your increased ICP. Now, what is the priority concern for oral hygiene for a patient who is unconscious? Okay, oral hygiene position. Oral hygiene position to the patient class who is unconscious muna tayo. The answer is semi-followers. Pero pag unconscious ka siya, always remember, lying on the side. Okay? Lying on the side to prevent aspiration. So the answer is letter B, boy. 35. There is what you called bed making. Now, additional teaching if indicated, which action is observed by the nurse while nursing aid is delivering the care. When you say additional teaching, meaning mali ang nagawa. Yes, I already told you that when you are wiping the what? The eyes of the patient from inner to outer canthus. That is letter B, boy. 36. A patient with a weak right leg uses a cane. Okay, now I told you if this is the brain, right, left, and then this is the face, right, left, and face, and this is the brain, and this is the body, right, left. Take note of this one. When there is a damage on the right hemisphere, the face damage is right, but the damage of the body is left. So the stronger side here is the right. So this is the area wherein you're gonna have to put the cane. So based on the situation, saan daw ang problema ni patient? May weak right leg. A patient with a weak right leg, where should the nurse stand while ambulating this patient? Of course, sa right leg ka mag-stand as a nurse. Kasi sa left ang hahawak ng cane. Naintindihan nyo? Kasi on the weaker side, nurse will stand. Okay? Si nurse andyan. But the cane is for the what? A stronger side. So since ang weak side natin is right, then nurse should position there. A patient on a left-sided weakness, why are you walking on my left side? I can hold on to you better with my right hand. What would your best therapeutic response? Okay, by walking on your left side, I can support you and help keep you from injury. By holding your waist, I would protect your shoulder if you should start to fall or faint. That is correct. So when you are assisting the patient on the ambulation, you need to hold the waist. Sometimes there is a belt that is being wrapped to the patient in order for the nurse to get support once the patient will what? Will be fainted or will fall. Letter D, dog. 38. Intravenous line hanged to a pole. Intravenous line hanged to a pole. Where should the nurse position himself? The same side. Why? Because if there is a problem with the IV, it will increase the flow of it depending to the position of the hand. Okay? So the same side, the nurse can regulate that one. Okay. How will you know? How will you know if the IV is still patent? A, are you going to put the bag down? Or letter B, higher the bag? The answer would be, to check for the patency, there should be put the bag down. Why? This would lead to what you call backflow of the blood if your bag is down by the virtue of your gravity. So letter A is the answer. Now on this question, number 39, which of the following statements of the client 139? Which of the following statements from the client with one weak leg regarding use of crutches when using stairs? Okay. Increased teaching, meaning to say mali ang ginawa niya. So, ganito yan. When you are using a cane, okay, the rule, the spell on the cane. Remember, there is a spell on the cane that you need to remember. What is the spell to remember on the cane? Good leg goes to heaven. Bad leg goes to hell. So, when you're going up, always remember this one, it's a principle. It's a spell. In order for the magic to occur, at unahin mo muna natin ang crutch on a good leg. Next to it, crutch. Sorry, wrong. Mauna muna ang good leg and then crutch and then bad leg. So that is the proper way on your cane or crutch walking while going up the stairs. While going down the stairs, ano mauna? Kasi bad leg goes to hell. Mauna ba dapat ang bad leg? No. Crutch ang mauna. And then bad. Then good. That is how it is. So the answer is, indicates where you're teaching, the weaker leg always go first. Mali. 40. Nursing aid is being oriented on the use of gurney transferring patients. The nurse correct understanding of its proper use when she states that she should lock the elevator open when entering or exiting with the patient on a gurney. Okay. Just to let you know, do you know what is a gurney? Do you know what is a gurney? So pag sinabing gurney, alright? A gurney class usually being used to the patient during the transfer. So, tandaan, during the transfer, and once there is what you call gurney, ilak mo muna yung elevator, sabi niya. So, paano po ba, Nurse Jane? Paano nga ba? Okay, this is how it is. A gurney, how to use a gurney? Okay, it's a wheeled stretcher used for transporting the hospital patient. So, you need to lock the elevator para makapasok si patient. So, this is like a stretcher. Yung parang pinapasok sa ano. Yes. Oo, parang stretcher rin siya. Or wheelchair, pwede din. Gurney. Or it's like a bed. Okay, let's continue. Number 40. So you should lock the elevator open when entering or exiting the patient on a gurney. Which description best fits the serous drainage form wound? Okay. Pag sinabing serous drainage, take note, this is a blood drainage. No? So this is usually being asked postpartum. Okay? So make sure when you use the serous drainage class, it is usually a clear, thin, watery exudate. No? This is a clear, thin, watery exudate. Alright. When you say sanguinous, it's a bleeding. There's a bleeding. How about when you say serous sanguinous? Pag serous sanguinous, okay, pag serous sanguinous na bleeding, take note, lumabas kasi itong sa board exam ng mga nurses, sa mga bagong BON, and take note of that, it is from pink to pale pink ang color. So pag ganyan ang color niya, the patient is having the serous sanguinous drainage. Okay, now, so the answer for number 41 is letter C. When obtaining a wound culture to determine presence of a wound infection, from where should the specimen be taken? Wound drainage, not on the wound itself. For wound culture, it's on the wound drainage. 43. An obese patient is at risk for skin breakdown. Yes, of course. Which strategies should nurse include in the patient care? Use a lift sheet. Yes, very good. Okay. Never ever drag the patient on bed. Once you drag the patient on bed, tendency niyan, magkakaroon tayo ng tinatawag na shearing force. Pag sinabing shearing force, guys, this would lead to what you call pressure ulcer. So, pag mamula na yan dyan ng area, or there's a, what you call non-erythema, it's non-blanchable, okay? When you say the stage 1 of your pressure ulcer class is a non-blanchable erythema. So when I say non-blanchable erythema, pag pinrest mo yung kamay mo ng matagal, ma-notice mo, di ba, magputi na siyang area. So pag non-blanchable erythema, magputi na, green na siya, hindi na siya magpula na.
Okay? Hindi siya magbalik. Pero kung ato ang normal kita may circulation, nagaputi siya, and then later mag-blunt siya, and then magpula na balik. And stage 2 naman, nagkakaroon siya ng very good crater na ang area. So, once there's a crater, meaning to say, meron na yan siyang blisters. So, stage 1, stage 2. Pag stage 3 na, ang inatake na dyan is your subcutaneous. While ang stage 4, ang ginagamit na dyan is on your, natake na ang muscle. Papunta na kay bone. Why mostly of the patients being having this kind of pressure ulcer? Because nurses forgot to turn the patient every 2 hours. That is our nurse responsibility, independent function natin yan. So we must have to remember about that. So what number are we? Number 42. 3. So letter A. The nurse is checking for discoloration of patient who has a darkly pigmented skin. Okay. Oh, it's not racist. The nurse would be administering appropriate care if which technique were used. Okay? So use a fluorescent light for assessment. Doon mo makita kung ano talaga ang tunay na if there is a discoloration in the patient. Especially when you have a patient who is what you call a Black American and you are going to check for the jaundice. Do not use the sclera. No for the sclera because it is normal for the Black American to have what? A yellowish sclera. No, may yellowish sclera sila, normal lang sa kanila yan. So next, so saan nurse yung i-check ang pag may jaundice ng Black American? You can use the hard palate or palms. Okay, you can use that one. Another concept is all about number 45. An elderly patient who spends most of his walking hours in a chair is at risk for skin breakdown, correct? On his buttocks. What is the most appropriate? Set a timer to ring. Very good. So you need to put a timer in order for the elderly to be reminded as well that they need to be changed their position. Okay? So, no. Sometimes hindi makalimutan nila yan. But when there's a timer, they will be aware. Alright. 46. About nutrition. A patient has a body mass index of 30. Oh my God, this is not overweight, but it's also obese. BMI, take note of our BMI. When you say BMI, body mass index, less than 18 is considered as underweight. 19 to 24, that is normal. 25 to 30, that is overweight. And then 30 above, that is obese. And all of these are considered as malnourished, no? They are malnourished people. So when they're malnourished class, except for this one, of course, that is normal. Okay, sorry for that. So 38 na yun kanina, masyado na siyang obese talaga. So the health risk related to extreme obesity. Correct, because there will be a fatty deposition na sa mga arteries niya. Mataas na talaga yung LDL niya. Dapat ang mataas always is the HDL, not the LDL. An alert-oriented patient recovering from back surgery and must remain flat. And he may turn on his side. What approach should use the nurse meet his nutritional and safety needs? Okay. Prepare the items on the tray, then watch the patient's ability to feed himself and assist as needed. Why? According to Virginia Henderson, sinasabi natin dito na pag ang patient class ay na hospital, we need to make sure that they're still maintaining the independence na tinatawag. So, pag able pa ang patient at kaya niya pa, then let them. That would increase the self-esteem. Kasi pang feeling nila, imbalido na yan sila na bumaba ang self-esteem nila. So, letter B is the correct answer. 48. A patient oxygenation saturation level is 97 nagbaba. During a coughing spell, even though the small bore feeding tube seems to be in place. What action should a nurse take initially? Elevate the head of the bed. Auscultate the patient lungs. Notify the physician. Okay, maybe there is what you call a feeding, small bore. But small bore feeding class is a continual feeding that we need to stop when there is oxygenation is decreasing. And then after that, notify the physician. 49. The nursing aide is about to enter the client's room with a meal tray. The registered nurse would remove which food if the patient is confirmed to be ovo-lacto vegetarian. When you say ovo, it's egg. Milk is lacto, vegetarian is vegetables. So, pesco. Pag fish na siya class, it should be pesco diet. When you say pesco, it's a fish. Okay? So, anong name i-remove nyo dyan? Ang fish. Okay? 50. Alright. You know that your carbohydrates, class, your carbohydrates is for energy source. Your protein is for what? Yes, very good. Tissue repair. What else? Your fats is for what? That is a concentrated source of energy. Kaya pag hindi ka kumakain ng rice, don't you worry. Do you still have fats? It will be breakdown, but it will be catabolized. Okay? So magkaroon ng breakdown ng fats, and then it produces still, the end of it is glucose. But the problem mostly, especially in diabetic patient, nagkakaroon sila ng tinatawag na ketone production kung type 1 ka. Now, so tissue repair, most of the patients, for example, the patient had a surgery. So the first diet on post-op, anong diet sa post-op dapat? First is NPO, wag kang masugat ng clear. Next, clear diet. Okay, clear diet. Next, full liquid. Then, what do you call this one? Soft diet. Yan. So, but before that, before siya na magbigyan ng clear liquid, make sure there is a passage of flatus or otot. So, pag wala yan, hindi pa nagkaroon ng return of the bowel sound. So, let's go. Increase, well, repair protein is the answer. Let's have 51. NPO several days and it's being considered a central line. Inserted, oh, this is TPN. Nurse expect to find to support this action. Why? Which laboratory test result would nurse expect to find to support which action? Alright. Naka-NPO siya for several days. Walang laman. It's being considered to have a central, to have, it's being considered palang magka-central line. Okay. So, for sure, the albumin is what? Decreased. So, si albumin kasi class ang nag-pulls ng water from the interstitial to the, what do you call this one? Intravascular. So, kung mababa ang albumin mo, most probably, especially nagababa ang albumin mo pag may NPO. So, parenteral nutrition, example of the parenteral nutrition is no other than your TPN. Take note, if you're gonna have to do your collaboration and teamwork, kinukuha ang TPN hindi sa dietary department, but to the pharmacy. Okay, prepare din siya ang TPN mo. All you have to do is to regulate that one. So, complications na dapat tandaan sa TPN. Okay, what are the complications to remember in the TPN? You got your hyperglycemia kasi mataas masyado ang glucose niya, but it is a complete nutrient. Number 2, it takes 3 to 5 days para magkaroon pa ng infection. And number 3, there could be an air embolism. And alert, there is no allergic reaction to this one. No allergy. So basta mag-TPN ka. So expect that the patient glucose is what? Tataas yan. Kaya makikita mo sa kanyang ihi. Kaya may tawag siyang tinatawag natin glucosurya. So, that's it. An indication that there is hyperglycemia. What else? Okay, make sure that you regulate the flow to prevent what? Prevent circulatory overload. Okay? Circulatory overload. Now, let's continue. What number are we now? Here we go. So, shortly after the venous catheter insertion, the patient complains of pain in his shoulder and chest is becoming restless. What is the priority? Oh, there might be an air emboli. So, restless kasi. So, that's it. Auscultate the patient's lungs kasi priority nursing action. Yes. When you say auscultate the patient lungs, why? Because you are talking about restlessness and the oxygenation is affected. The vital signs, other vital signs are not affected here. So are our lungs. So letter C would be the best answer. Yun ang masakit kasi bakit? Letter A is assessment, letter B is assessment, letter C is assessment, D is assessment. So kung hindi mo alam ang konsepto about restlessness na may hypoxia ang patient, so tendency hindi mo talaga makukuha ang sagot niyan. So the answer would be letter C, 53. TPN ang sabi ko may hyperglycemia. So what is the best answer in letter A? Number 53, it's letter A. No, may hyperglycemia si patient. 54. Total parenteral nutrition infusing has a disconnected the tube in the central. Oh my God, the patient is prone to air embolism. Andyan nga. The nurse should immediately place the patient with, that is Trendelenburg. No, it's not Trendelenburg. When you put the patient on the Trendelenburg, you increase the return of the blood going to the lungs. So magkakaroon ng pulmonary embolism yan. So on the left side with the head higher than the feet. So on position, that is reverse Trendelenburg. Okay, reverse Trendelenburg ang position natin. 55. In case of TPN will interrupted, the nurse should be ready to administer which solution? Okay, remember, your TPN is high in glucose, right? So pag high in glucose siya, at na-interrupt or na-block at hindi nagkaroon ng supply kay patient, make sure you do have a solution at the bedside na tinatawag natin 10% dextrose. Thank you. Now, number 56. Anong meron dito? The patient is having diarrhea and dehydration. Oh, really? So, selected size? Ay, okay. When I was young, I had this kind of situation. So, my mom told me that there is an insertion of the IV happened. There was an insertion of IV happened on my skull. Okay? Kasi hindi pa masyadong ang vein ng baby. So hindi pa masyadong okay para lagyan ng needle. No, insert ng needle kasi baka fragile pa siya masyado. So 20 gauge into a scalp vein. Nurse Heather is starting a non-tunneled peripheral catheter in a client's with cephalic vein. The client screams out, reporting pain on the shooting up his arms. What action should the nurse Heather do first? Okay. Alam mo na sumisigaw na siya, di ba? So hindi mo na i-assure yan. You cannot give topical anesthetic. You're not a doctor. Mas maglala kasi namigay ka pa ng sisi. So that is letter D, dog. Remove the catheter. So the computation for this one is 60 drops per ml. So please do the solving. Okay? On this one, 20 mx. With G factor, please do the solving. 25 drops per minute. At least may trabaho din kayo. The earliest sign of peripheral IV site phlebitis is, okay. Earliest, ang tinatanong ha, earliest sign of IV site phlebitis. Alright? So, here we go. We do have this complication of your IV, which is phlebitis, and you have your infiltration. So, infiltration, guys, because na-dislodge, okay? Usually, the cause of the result of dislodgement is infiltration. But if there is an inflammation or infection to the vein, so infection to the vein, that could be your phlebitis. And the earliest sign could you always be tenderness. Okay, the tenderness of the area, that is a sign of your earliest sign of your phlebitis. Now, pag phlebitis, mainit ng area, hindi siya pwedeng redness. Hold on.